Hey everybody, it's Sarah, and this is my week 17 video update. I haven't posted since, I guess, week 12 or 13. So, sorry about that. I had a lot going on and been really busy. Um, so, I guess what I'm going to start out with doing is backing up and going back to week 13. So, 13 weeks and 6 days I went to the doctor, the high-risk doctor, and they informed me that they were going to do a cerclage, which, I had pretty much assumed that they were going to do. They done an ultrasound, and my cervical length was 3 centimeters, which wasn't really bad, but they wanted to get it in, before my cervix started dilating. So they went ahead and wanted to do it the next day. So the day we did it, I was 14 weeks. We went into the doctor that morning and got admitted into the hospital, and they set me up, kind of talked to me about it, and I kind of had a heads up because I'd had a cerclage before, so I knew what to expect, although this time it was a little different than last. So getting prepared for it was still the same. They gave me an IV, hooked me up to some fluids. They put antibiotics through the fluids because with the cerclage, of course, there is risk of infection occurring. After that, I guess I was there for a little while, a few hours, I guess, because they had to let the antibiotics run through. My anesthesiologist came in and talked to me. They done a spinal, which is kind of like an epidural, only a little different. Pretty much the same concept though. It doesn't last as long. So my anesthesiologist talked to me and kind of, told me what was going to happen whenever they came in, and they gave me a Motrin before because they said I'd have some cramping afterwards, which Motrin is not safe to take all the time during pregnancy. It was just a one-time thing, and I didn't want to take anything more than that. So they took me back to surgery. My husband was able to stay with me until they took me back to the room. In the room, I had a spinal block done. I had to, if you've ever had an epidural done, it was kind of the same way. I had to lean up forward and, stay still for a second, and it really didn't hurt. It just kind of felt like a little pinch. I know a lot of people are scared, of the long needles, and there's a big fear of that, but it really didn't hurt. It was just a little pinch, and that was about it. And afterwards they laid me down flat. Now the cerclage that they done was a McDonald's cerclage, so they came in and done it vaginally. Of course I couldn't feel it because I was numb from the waist down. So they went in vaginally, they put the cerclage in. The actual procedure only took about 5 minutes, that was it. And after that, they took me back to recovery. And I was there for a while. I guess I was probably there for about 9 or 10 hours. Now, before I left, they kind of monitored me, make sure I wasn't having contractions. I had to lay there for a while, because of course you can't get up and walk because you're numb. So my 2 things I had to do before I left the hospital was I had to be able to walk on my own, and I had to be able to pee. And I could actually walk for about 2 hours before I was able to urinate for the first time. I guess all that was still a little numb. Afterwards, I was able to go home. I was told to take it easy, for a few days or a week or however long that I needed. I had, sorry, I've got a cold. But I had more cramping after this cerclage than what I had with the previous cerclage. And then I had something else that happened that didn't happen before. I took Tylenol afterwards, and I was trying not to take any medicine, but it just got to the point to where it was pretty much intolerable. After about, 2 days, a lot of it went away. Excuse me. But Yeah, after about 2 days it went away, but I stayed in the bed a lot. Of course, after the cerclage there was bleeding, which was normal. Now, there was no heavy bleeding. It wasn't bright red. It was like a light pinkish color. So there was, no worries there. My bleeding really, it wasn't heavy. They said if it got heavy like a period, to cut me in, that something might be wrong. But it was really light, and it tapered off after a few days. And I was swollen. That was probably my biggest problem, was being swollen so bad. So something that I did to try to help it, I thought about, taking a SIDS bath. If you've ever, already had a baby afterwards, a lot of times it helps, but the swelling was so up high that it really, the SIDS bath really didn't help any. I was swollen some down there, like lower, but it didn't last as long. So after the surgery, I was, of course, you can't have anything inside of you vaginally for up to 2 weeks after the surgery. So the first week I got some help from my mom with the kids. Of course, my husband was with me. Then after that, like sex after cerclage, some doctors don't want you to have sex. Some it just depends on, where you're at. Of course, if you're already dilated, they probably don't want you to, but definitely not at least 2 weeks. And it's something I had to call and ask my doctor about too. That puts a taper on a pregnancy, because your second trimester is whenever you're feeling better and you're not really big yet, but you're not throwing up all the time. So that's about the only time that you actually feel like having sex. But whenever you have to have a cerclage in, that kind of cuts those things out. But I guess you have to look at what's more important than your raging hormones. So at about, I don't know, probably about 15.5 weeks, I started feeling a whole lot better. And then what I also want to talk to you about was we started in, my husband ordered this book, and I never done this with any of my other babies, but it is the Bradley method, and it's husband coached childbirth. So this is something that I've been looking into. Of course, it's a natural childbirth, and I hadn't really looked into it before. I thought about maybe having a doula. And I probably haven't gone into this for the reasons that most, natural mothers do. Mine has more the Bradley method really teaches you how to relax during labor. And, whenever you're in labor, labor is hard, it's rough, it's pain, it's hard to deal with. And there's actually classes that you can take. A lot of them are 12-week classes. Some of them I think are even 16 weeks. But right now we've just started offering the book because, right now I'm 17 weeks, so we're not quite there yet. But I done this because I started looking into this for one because this is something that I want to talk about. It's kind of hard. Of course, you all know that I had to deliver a baby at 20 weeks gestation, and she died. Well, of course it wasn't just like a miscarriage to where, something fell out in the toilet. I actually went through the labor. I had to push. During the delivery, I refused to push because what happened was my membranes were bulging, and my cervix was fully dilated. There was no cervix left. So at that point, there was nothing that they could do. Sometimes they try to put in an emergency cerclage or kind of put you up, kind of tilt it with your head down upside down. I know a few women who have had to do that, but they tend not to put a cerclage in if you're past 4 centimeters dilated, and I was fully dilated. So at that point, there really wasn't anything I could do. But as her mom, I knew that as long as she was inside of me, she was safe. So during the actual, labor, whenever it came time to push, I couldn't do it. I couldn't, as her mom, I could not push her out because I don't know, it was hard. But she ended up coming out anyway, with, I guess because she was so small, it was only 20 weeks. But I didn't realize how much it stayed with me, because I've coped with my daughter's death. You know, I mean, I know that she's in a better place. You know, I love her. I think about her every day. But at the same time, I've made peace with the fact that she's not here. At the same time, I didn't expect it to affect me in labor as it did whenever I had my son, my youngest that I had. Now, whenever I was in labor, whenever I was having those labor pains, I wasn't able to relax. And in a way, my mind kind of backflashed back to whenever I was having my daughter, and I associated pain with her death and that pain. And I was emotionally a wreck. I was not able to handle the labor in a way that I was able to handle it with my first child. Relaxing was really hard to do, and pushing was hard too. And I know it seems a little illogical, and I didn't really expect to emotionally feel like that, because, you know, it was a different baby. I knew he was going to be okay. You know, he was a little early, but it wasn't the same scenario. But, you know, whenever you're in labor and you're in that much pain, you're pretty vulnerable, and I don't know, I just had a hard time with it. So I wanted to do the Bradley method, because, for one, whenever I'm in labor, I want to be able to have support. And this is also a good book for your husband to read. My husband has been reading this book, so he has actually gotten really involved in my pregnancy since he's been reading this book, and he's been getting excited about it. So, in the Bradley method, of course, it's not just about labor. It's about your whole pregnancy. Every, you know, first, second, third trimester. Things that you can do to help with heartburn, with the morning sickness. And if you're like me, the morning sickness has decreased, but it has not gone away all the way. And it teaches your husband how to be there and how to be, you know, supportive of you. And whenever you're in labor, whenever you're carrying a baby after you've lost babies, you need support. And I know we think that we want to do this on our own. We want to push through it, and, you know, but we need support. It's important to have support. So my husband has really, you know, he's read this book too, and I'm amazed at him. I think he's going to do wonderful in the delivery room. But I also had thought about looking into getting a doula, and I kind of looked into the price ranges of it. I'm not really sure if I want to do that or not. My main thing is the Bradley method shows you how to relax, so I want to be able to do that, of course. I'm having my baby in a hospital, in a setting to where I'm not sure if I'm going to make it full term. I'm not sure if I'm going to have the baby early. It's hard to be relaxed, you know, whenever you're in labor and you're hooked up to everything, and you have people coming in and out of the room, all these things. The good thing about the Bradley method is it teaches you things that you can do to have the hospital room kind of in a relaxed setting. Because moms like me who have to have a cerclage, who have lost a baby, there's no way you're doing home childbirth. You know, you're gonna have the baby in the hospital. But I think it's important to have support there. If you need to, you know, pull away from, you know, the natural state of labor to kind of get your, you know, head back in the game, that you need someone to be able to support you there. And I know from experience that I need someone there. I don't know if this labor will be as hard, but just in case that it is, I really want someone there. I really want my husband to be able to be there to support me in every way. I don't want him just, you know, sitting there and not being a part of it. And for the dads, it's important too, because this is their baby, you know, and who better to be there, to be the one to be there to support you and get you through every moment of it, you know, than the daddy. Or, you know, even if not the daddy, you know, whoever the partner is. For me, you know, it'll be my husband. And this is very exciting for him because this is actually, you know, his first baby, of course, because, you know, my other children were from my ex-husband. So, you know, I think it's important to have, and I don't think women who have lost babies, maybe it don't happen with everyone, but, you know, for me it did happen. I did backflash. My mind went back, you know, to being in labor and delivering, you know, a baby that was going to die. My mind went back to that. And can you stop that from happening? No, probably not. But, you know, I feel like I can have the support there to where I can get my mind back in a place to be able to handle it. To, you know, I can be able to pull away and take a minute and say, okay, you know, I've made peace with this. This is not the same scenario. You know, things are going to work out this time, to stay positive about things. And sometimes it's hard to stay positive. And, you know, if you went through more than one loss too, you know, and what if you had an incompetent cervix and never actually had, you know, a normal delivery? Well, then you don't even have that experience to relate with. So support is very important. So I wanted to ask a few of you all if you could, you know, comment, or maybe some of you have had a cerclage or had a loss and had a natural, don't have to necessarily be a natural childbirth, but maybe you've had a loss. You know, you've lost a baby. You know, second trimester, third trimester loss, and then you had to go and do it again. The next time, I mean, how did you handle it? How did you get through it? Because for me, it was traumatic. The second delivery, even though everything was going okay, it was still traumatic. So, right, the only thing I have right now is the Bradley method, and it's really helping a lot, and the support I think is really important. But I mean, if you all have anything else out there, any stories of something that may have helped, or let me know. But I go back to the doctor on whenever I think it's 19 weeks, so it's like 2 weeks from now, and then I'll figure out what the baby is, of course. Now, I'm not sure if we're going to figure out, actually. We're still talking about it, whether we want to know yet or not, so we've not decided. But whether we find out or not, we're not going to tell everybody until the baby shower. We're going to kind of announce it there. I guess, other than that, that's it. But I'm not sure whenever I'll make the next video. I've been so busy here lately. But of course, when I go back to the doctor, they're going to check my cervical length and see how I'm doing. Right now, everything seems to be doing okay. I had some Braxton Hicks contractions after surgery, but I drank some water, laid down on my side, they went away. I've not really had any issues, which is really unlike my other pregnancies, because I had issues from the get-go. So I'm crossing my fingers that everything is gonna go good. So I guess I'll let you all know whenever I find out my cervical length, see if my cervix continues to shorten, how it goes. But thanks, y'all.